Hi, my name is Ann Warren, and I'm going to present my project on the Spanish flu pandemic. In my final project of the Spanish flu pandemic, I will talk about how the pandemic influenced the development of public health initiatives and awareness during and after World War I. Influenza spread as fast as wildfire. For some people, the story with influenza began at home. Harriet Hasty Farrell lived at home with her family. Harriet Hasty Farrell said, "My mother was caring for 7 sick people in her home." Chazzy 1655. It did not matter what age someone was. Everyone was at risk of catching the illness. Many people did not even have to go out in society to become ill. No one was safe from influenza. People that lived in poverty might have lived in close quarters in a home and might not have been able to spread out in the home to avoid being infected with influenza. Nurses were heroes. People were not safe from influenza at home or anywhere else, so nurses became the heroes. The pandemic contributed to more chaos during an already troubling time during World War I. While medical staff were portrayed as heroes themselves, they were overburdened as they were not able to contain the spread of disease. It did not matter if someone was rich or poor. If they were at the hospital and they contracted influenza, they could still die. Hospitals were not able to save everyone from death. Josie Mabel Brown was a nurse, and her niece, Carla Morrissey, was interviewed in the documentary. Carla referred to her aunt by saying, "She walked into the ward, and not only were the 42 beds full, but there were boys that were laying on the floors and on the stretchers, waiting for that boy in the bed to die." Chazzy 2349. This illustrated how unprepared medical staff were during the public health crisis. Nowhere was safe from influenza. The end of World War I brought large crowds together to celebrate during the Spanish flu crisis. This led to the further spread of influenza. Here is a quote that described how many people were in close proximity to one another in the crowds. In San Francisco, the scene was surreal. 30,000 people paraded through the streets, all dancing, all singing, all wearing masks. Chazzy 4502. Large celebrations during the Spanish flu led to many visible long-term social and cultural impacts. People lost social trust because influenza caused disruptions in their social circles. Influenza prevented people from being able to go to school. People had to learn to adapt to isolation. It was harder for poor people to isolate. They also might have suffered from poor nutrition, which would have affected their ability to recover from influenza in comparison to a wealthy person that might have been able to afford better quality food or nursing care. Hospitals were drained of resources, of not having enough nurses to care for their patients. The social and cultural impacts from the Spanish flu are viewed similarly to COVID-19. The Spanish flu has been largely forgotten. However, the recent outbreak of COVID-19 brought renewed attention to the earlier pandemic. In 20 years, the government will be better prepared for future pandemics. But regardless, there will still be people who refuse vaccinations and refuse to wear a mask. People will look back at this time in history and reflect that while people were forced to live in isolation, some will have long-term effects of depression. The unemployment that many face will continue to affect some families in the long term. Many people lost loved ones, which will affect families 20 years from now. People with low incomes will still be at a disadvantage to access medical care and won't be able to afford medications if they become ill. Even though people were losing loved ones to influenza, there were still health crisis deniers in government. Government officials were seen as bad because they didn't do enough to warn the communities on the dangers of the disease. Dr. Alfred Crosby, who was a historian and an author and interviewed in the documentary, said, "The first reaction of the authorities, for many, the most important ones, which is flat out denial." Chazzy 1515. This highlights how officials fail to protect their communities. Dr. Alfred Crosby also said, "The war demanded everything should speed up." Hazy 1602. This shows the dire situation of World War I colliding with a public health crisis. There are many unanswered questions about why the government leaders were in denial and seemed emotionally detached from the Spanish flu. The PBS American Experience Influenza 1918 video did not show the reasons the government officials were in denial. Could the denial have been from the fear that monetary reasons would have dissipated communities' budgets and caused economic issues? Were monetary reasons the cause of delays in communities establishing social distancing guidelines because of the fear of tax revenues that were projected to have been lost? Had the federal government provided communities with financial support early on, could more lives have been saved? Monetary reasons seem like a big hurdle that could have led community leaders to avoid facing the Spanish flu pandemic. Communities that were not in wealthy areas might not have had the same financial resources to implement costly public health requirements and would not have had the financial resources to pay wages to people to enforce social distancing guidelines. What could have been done better? To better aid society during this time, government officials could have established curfews early on and required social distancing. Places could have had shorter hours and allowed businesses to open on a restricted basis. However, because of denial, this did not happen and lives were lost unnecessarily. Financial decisions may be a little studied factor of the spread of the pandemic. Many survivors' perspectives of the Spanish flu remain in the historical record. The PBS American Experience Influenza 1918 video that interviewed survivors portrayed a personal touch to viewers. The interviews were conducted strategically to make people feel a certain way. Viewers might have been more inclined to be supportive of the survivors' experiences because the viewer could connect to the emotional toll that the survivor experienced. The video showed interviews with various women. This might have been a strategic choice because some people might view women as more emotionally expressive of their feelings. At the bottom of the slide, I have a reference. New York's health commissioner avoided implementing public health measures early on to contain the spread of disease in New York. Influenza was transmitted to New York City's harbor by the ship Bergensport on August 11, 1918. Poor nutrition on the ships affected the sailors' immunity against the disease, and there were no adequate screening measures before the sailors boarded the ships. Ill sailors were brought to a hospital, and eventually the entire port of New York was quarantined. New York on lockdown continued. Dr. Royal S. Copeland, who was a health commissioner, did not want to shut down public places and instead focused on isolating those that were ill. Copeland believed that the pandemic would soon dissipate. He was subjected to harsh criticism for this decision. At the bottom of the slide is a reference. Military officials also dragged their feet on implementing preventative measures. This document is a telegram that was sent on October 16, 1918, by Squadron Official Wilbur Wright Field in Fairfield, Ohio, to notify the Adjutant General of the Army that a private died from influenza. A private died that served in the Army in Fairfield, Ohio. The telegram shows the disregard of the military officials to contain the spread of disease. By not enforcing strict social distancing and quarantine measures, military officials did not protect the lives of those in the line of duty. At the bottom of the slide is a reference. To contain the spread of influenza, a county food administrator in Oklahoma had to cancel public meetings. This document is a telegram that was sent on October 3, 1918, from Jack Kelly, who was the Latimer County food administrator in Wilburton, Oklahoma, to notify headquarters in Oklahoma City that a public meeting had to be canceled due to the spike in Spanish influenza cases. Wilburton, Oklahoma, officials realized social distancing measures were needed. This telegram was sent to C.B. Ames, another officer at the headquarters. It describes the strict public health measures used to stop the spread of the disease. I chose this document because it reinforces the fact that public health officials had to make drastic changes to protect human life. At the bottom of this slide is a reference. Just like officials in the Army were having to implement social distancing regulations, so were officials at the Yakima Indian Agency in Washington. This document is a school letter sent on October 29, 1918, from the superintendent of Harwood Hall to notify a student's parent that their daughter died from influenza at an Indian boarding school. The name of the superintendent is unknown. The indigenous natives were discriminated against and were not treated as a priority. This letter was directed to the student's mother. The context of the letter was that the superintendent was too busy to write to the parent earlier. This showed that the indigenous natives were not treated as a priority. The letter proves that the school was trying to deny accountability and that Native Americans were treated differently. At the bottom of the slide is a reference. As the government failed to treat Native Americans humanely, sailors in the Navy fared better. This document is a government directive that was sent on September 26, 1918, from the Department of the Navy's Division of Sanitation to give recommendations to sailors on how to avoid being exposed to influenza, recommending home remedies to fight off the illness. Navy sailors' health was at risk, especially since they lived in close quarters with others. This government directive was intended for United States Navy sailors in service during the time of the Spanish flu era. The measures described in the document imply that government officials were aware that mass infection would greatly interfere with the health of the sailors. The sailors were more susceptible to being exposed to influenza and therefore inadvertently becoming the carriers of the disease. At the bottom of the slide is a reference. As sailors in the Navy were affected by social distancing measures, a military depot in Philadelphia experienced a staffing crisis. This document is a military report that was sent on October 8, 1918, by B.M. Holden to Colonel L.A. Nicholson in the Operating Division. He wanted to notify that many military personnel were not able to report to work due to the dire increase in Spanish influenza cases. The military depot in Philadelphia exposed workers to poor working conditions, which contributed to the spread of influenza. This military report that was sent to Colonel L.A. Nicholson to report that there was a staffing shortage that was not looking to get better soon in Philadelphia. It describes how the factory workers were more affected because of the poor conditions, and they were forced to work closely together. The factory workers were treated unfairly to make someone else rich, to the point of being forced to work while being sick, which caused the disease to spread like wildfire. This is another instance of money over human life. At the bottom of the slide is a reference. While there was a military staffing shortage in Philadelphia because of workers being in close proximity, the inhabitants of Western Shoshone Agency acknowledged the need for the Native Americans to stay away from crowds. This document is a government report from Superintendent N.D. Lachey to notify the inhabitants of Western Shoshone Agency of rules to be followed during the increase of Spanish influenza cases. The indigenous natives were belittled and were treated as less important than other people. This government report is directed to those on the reservation, demanding that they adhere to ordinances that were put in place. It describes how they were expected to stay away from crowds and laid out rules for leaving the home. The government strictly controlled the reservations and insulted their culture and their intelligence. The report stated that women and children should stay at home and the native people would be served on the porch at offices, which shows that different races were discriminated against. At the bottom of the slide is a reference. While the indigenous natives at Western Shoshone Agency were ordered to adhere to rules for if they needed to leave the home, South Beach Hospital in Washington struggled with an influx of patients in a crowded hospital. A hospital journal that the staff at South Beach Hospital maintained from 1918 to 1919 informed the medical staff superiors that oversaw hospital records. The hospital journal notes when patients were admitted and some of their death dates. The hospital journal highlights the limitations of the medical staff in being able to save everyone from influenza. Although hospitals were seen as a place to get medical help, they also became centers of infection. At the bottom of the slide is a reference. Conclusion. After extensive research, I have concluded that monetary reasons contributed to the delay in implementing public health measures to stop the spread of the Spanish flu. During COVID-19, the government response was better. Programs were able to assist communities and individuals financially and regarding their health. Perhaps Americans have learned the lessons of the Spanish flu pandemic after all. There will be more lessons to be learned from COVID-19 and future pandemics. The end.